There's never been a more important time to ensure your immune system is operating at its peak. This is Dr. Ronald Hoffman with a new natural solution from Future Farm Botanicals created exclusively to help promote a better immune response. Elderberry with zinc and echinacea. Future Farm's elderberry with zinc and echinacea is the first to combine these three powerful ingredients together. Elderberry is packed with antioxidants, vitamins, and may boost your immune system. Echinacea has been shown to activate chemicals in the body that decrease inflammation, and zinc activates T lymphocytes. Low zinc has been associated with increased susceptibility. For more information and to order, call 888-841-7216. That's 888-841-7216, or go to myfuturefarm.com/Hoffman. That's future, PHARM. myfuturefarm.com/Hoffman. Elderberry with zinc and echinacea is all natural, science-based, and works without adverse side effects. myfuturefarm.com/Hoffman. myfuturefarm.com/Hoffman.
Welcome to Intelligent Medicine, America's foremost program on health, medicine, and nutrition, featuring the latest on both conventional and alternative therapies. Now, here's Dr. Ronald Hoffman.
Welcome back to Intelligent Medicine, another hour of the weekend edition of Intelligent Medicine. We've got lots to talk about this hour, plus your phone calls, 877-726-8255. Among the things we're going to discuss, a natural over-the-counter supplement that enhances women's libido and increases fertility if they're contemplating in vitro treatment for inability to become pregnant. 877-726-8255. Also, are dairy foods really so bad for your heart? We'll cover those stories momentarily, plus other stories in your phone calls. But first, let's talk to Roger from North Carolina. How you doing? Welcome.
Hi, Dr. Hoffman. Thanks for taking my call. I have a quick question. Want to know if there's any natural way to lower my sex hormone binding globulin. My total testosterone is well within normal, but the free testosterone is quite a bit below normal, and the sex hormone binding globulin is way above normal. And the urologist says the only way to do it is to pump you full of, extra testosterone to overcome the sex hormone binding globulin. Yeah. I'm wondering if there's a more natural way to do this.
There is a little bit of a buzz on a dietary supplement called Nettles that can help to do that. But let me find a little bit about you. What is your height and weight, please?
My weight is 156. My height is about 5'10" and a half.
Okay, so you're a slim guy. There's not a lot of fat that's getting in the way of the testosterone. What about your sleep levels? You have adequate sleep?
Well, I don't really sleep all that well. I try to get 7 or 8 hours a night, and I don't always achieve it. I take valerian and melatonin and lemon balm and theanine and all that stuff. And, I sleep and then I wake up to pee, and then I sometimes have trouble getting back to sleep. But, Are you tired, devitalized, demoralized, highly stressed out? I wouldn't say that. I exercise every day. I hike an hour or 2 hours a day on the mountains, and I eat an organic Mediterranean diet. And I take.
I would say that this is kind of a non-problem because when the opposite thing happens. When you have low sex hormone binding globulin, that's often associated with metabolic syndrome, prediabetes, and fatty liver. And so you're a fit guy. You feel pretty good. Are you looking for a little boost in the sex department?
A little more libido, yes. Mm-hmm.
A little bit more libido, okay. But it doesn't sound like you're really knocked out. And how old are you again?
73.
73. So, there are a little bit of a natural decline in testosterone. When the sex hormone binding globulin may actually protect you from the adverse effects of testosterone. You still have a full head of hair?
Pretty much. Maybe a little bit of thinning at the top, but mostly
That's pretty good. Yeah, I'll take that at 73. So, what your body is doing is it's kind of self-regulating the testosterone. You're producing adequate testosterone because you're a healthy guy, and the sex hormone binding globulin was binding some of it up, perhaps in a sense to protect you. So, I'm going to flip the question is, not so much what can you do to lower the SHBG, the sex hormone binding globulin, but like, why go there? And why take testosterone if you're feeling otherwise well? I liberally prescribe testosterone to men. And sometimes we include testosterone in regimens for women. And I'll talk a little bit about something that we can give women to enhance their libido. It's not testosterone, because testosterone is a prescription thing. We want, more benign over-the-counter things. So I would say, not to worry. And the other thing about it is when they calculate your free testosterone, a urologist once explained it to me. It's just a mathematical calculation. It isn't necessarily accurate. They usually don't measure directly your free testosterone. That's kind of a special test. So it's a mathematical calculation that may not be relevant to your clinical status. And it's not something you need to fix necessarily. So I would say, you could take some dietary nettles. It's an over-the-counter supplement. See if it helps. But I'm not that zealous to lower your sex hormone binding globulin.
Mm-hmm. One last thing. It seems like this really took a drop after I had Lyme disease in 2017. Is there any association between Lyme disease?
Oh yeah, anytime you have some severe or debilitating disease, and now we have to include COVID, we see sometimes precipitous declines in testosterone. Not necessarily a rise in sex hormone binding globulin, but testosterone gets killed when you're sick because it just gets hammered. And sometimes viruses and certain infections directly attack the gonads, but they often leave men and women debilitated because their sex hormones are knocked out. So yeah, there's a possibility, but then again, you recuperated from it. You feel good. You're pretty energized. Yeah. And I'm thinking maybe that's just, in the rearview mirror and not a problem now.
All right. Well, thank you. Appreciate it.
My pleasure. 877-726-8255, our number. And let's take a look at a medley of things that we can do to protect our children. I wrote an article about it a while back based on some of these studies. Here's one on breastfeeding. The question is whether breastfeeding has an impact on either autoimmunity, as indicated by the risk of celiac disease, that's an autoimmune disease, and type 1 diabetes is an autoimmune disease where the immune system attacks the pancreas, or allergies. So they did this big study. They looked at breastfeeding, and what they found is that longer breastfeeding did not protect against celiac disease or type 1 diabetes, unfortunately, in the study. But it was associated with a decreased risk of seasonal allergic rhinitis and obesity at 5.5 years of age. They followed these kids for 5.5 years, and they found that they had less allergies and were less susceptible to overweight. Okay, here's another thing that's kind of a preconceptual thing. Whether or not moms use the oral contraceptive, the birth control pill. This study suggests that having used the birth control pill, obviously you stop the birth control pill to get pregnant, but women who use the birth control pill can give rise to a higher likelihood of allergic diseases like asthma and allergic rhinitis in the kids. Kind of interesting. They're not taking the birth control pill, obviously, when they're pregnant or right before pregnancy, but it may have a lasting after effect, increasing kids' risk of allergies. This study looked at polyunsaturated fatty acids in the mother's diet. Maternal polyunsaturated fatty acid intake during pregnancy. Now, of particular interest are the polyunsaturated fatty acids such as EPA and DHA. Those are derived from oily fish and some plants. What they found was that the maternal intake of these beneficial omega-3 fatty acids was associated with total gray and white matter volumes in the offspring in late childhood. They followed the kids into development, and then they looked at their brains using MRI technology, presumably. And what they found is the more omega-3 fatty acids the moms consumed in the pre-pregnancy and pregnancy period, the more gray and white matter their kids had. That's pretty important. So when I give pregnant moms EPA, DHA supplements, I ask them first off, how smart do you want your kid? You want, junior, you want trade school? You want junior college? You want the Ivy League? Or do you want your kid to be perpetually a student in search of more and more professional degrees, PhDs, and so on? And if they say, and they usually do, they say, I want my kid to be as smart as possible, I give them omega-3s. And this final study has to do with the use of fruit juice taken in infancy. Lots of kids guzzle fruit juice. And what they found is that higher fruit juice intake in infancy was associated with greater abdominal adiposity. Surprise, surprise. Kids are fatter. They say our findings support limiting fruit juice intake in infancy, which can have later impact on visceral adiposity. That's the worst kind. That predisposes to metabolic diseases like metabolic syndrome and diabetes in childhood and adolescence. And the APA, the American Pediatric Association, has an official position where they say don't give kids fruit juice until a certain age. And if you do, give them a little fruit juice and dilute it with seltzer. That's a better way to get kids to hydrate. 877-726-8255, our number. And this is Intelligent Medicine. As an Intelligent Medicine listener, you know how important it is to ensure that your supplements are genuine, safe, and effective. But vetting your sources and tracking down the exact products you need can be a hassle. That's why I'm inviting you to browse my online supplement dispensary at drhoffmanstore.com. We stock only the highest quality supplements, some of which are very hard to find elsewhere. The very same supplements I prescribe to my patients and take myself. My specially curated professional-grade supplements are fulfilled via the FullScript network. FullScript is the safest and most convenient way to purchase my medical-grade supplements. Buying through FullScript offers fast shipping, optional refill reminders, a mobile-friendly site. It's safe, secure, and HIPAA compliant, and offers world-class support. Just go to drhoffmanstore.com to sign up for your free FullScript account. You'll also receive free shipping on all of your store orders. That's drhoffmanstore.com. drhoffmanstore.com.
Mom, can I have some spray?
Sure, honey.
Thanks, Mom.
You know what that is? That's the sound of my child thanking me for getting her something that's actually good for her teeth. Spry Gum is part of the Spry Dental Defense System, a complete line of oral care products made with 100% xylitol, the all-natural sweetener with proven dental benefits. So when we're at home, my whole family uses Spry toothpaste and mouthwash to help strengthen our teeth and reduce the risk of tooth decay. And when we're on the go, I just throw some Spry Gum and mints right into my bag. My kids love it, and I love that it's all natural. No sugar, no aspartame, or any other chemicals. Just think of that. I reward my kids for taking care of their teeth at home by giving them gum and mints on the go that are good for their teeth. Visit sprydental.com or ask for Spry by name at your local health food store. You can also ask your dentist about Spry and make sure your mouth is receiving all the benefits of 100% xylitol products.
At Vitamin Shoppe, Sprouts, Kroger, and most natural product retailers. Find a retailer near you at clear.com.
Back to Intelligent Medicine, Dr. Ronald Hoffman here. Our number 877-726-8255. You might want to jot that number down because you can call at any time during the program or even in our off hours, and you can record a question. We have a live caller, however, Jeff from Wisconsin. How you doing, Jeff?
Good. How are you doing, Doctor?
All right. Yeah, I unfortunately, I have to share with you that your Badgers are losing to Michigan. The Wolverines are beating them so far. I got the TV on in the studio with the sound off, and I'm watching the game. And the Badgers are not faring too well. Well, maybe they'll catch up.
Well, Michigan's a fine place as well, so there's no real loser there, I guess.
That is generous of you to say. Okay. So what's your question?
Well, in August, I had a bout with the COVID virus. I'm guessing it was the Delta. They said everybody now is getting that Delta one. Anyways, for whatever reason, I was called by my local provider and said I was a candidate for the monoclonal infusion. So
yeah, that's a good idea. That's one of the few things that is effective in the early stages of COVID, and it's worth a shot. So you went to get an IV.
Yeah, I went and had that done the next day then, and I guess my question is, at this point, I'm feeling pretty good. The only thing that I have residual is a tinnitus, a ringing in my ears that kind of just stayed there. But everything else, I mean, I'm working out. Everything's back to normal. But as far as getting a vaccine, I read that if you've had it in a lot of other countries, they just recommend one dose.
Mm-hmm. Yeah.
Here they want the, and since we have,
it's a one size fits all here in the United States, unlike other countries where they say, okay, you have some natural immunity, maybe you want to boost it a little bit, but don't go overboard. Yeah. Okay. This is an important question, Jeff. And by the way, did you feel better from the monoclonal infusion? Did it turn things around for you?
Well, to be honest with you, that was, I actually got worse that night. I mean, that's when my fever actually spiked into a legitimate fever, about 103. But I did, I kept progressively getting better each day.
So maybe the monoclonal antibodies, I kicked your immune system into high gear, and you had a kind of a quick burn off of the infection. Yeah. So maybe they helped. Who knows? Okay, so what your question is a good one, because there is, and I actually did a little research on this subject. There is known in virology something called an ADE, which is called an antibody-dependent enhancement. And it can work either way. It can work like, okay, if you've taken a vaccine and then you get the infection, could it be that the antibodies created by the vaccine, could it make the infection worse? Could it interfere with your immune response? And this is actually a known phenomenon with certain conditions, or vice versa. If you get sick and then you take the vaccine, is it possible that the vaccine can cause an enhanced reaction to the vaccine? So with a real kind of a backfire of the vaccine, like really like a kick in the rear. So it turns out that while this is the case for certain viruses, like dengue, for example, they try to pioneer a dengue vaccine, that this is not the case for COVID. But I want to continue a little bit on this subject when we return. Our time is running short. Our biological clock is ticking as we reach the bottom of the hour. So we're going to talk about the risk of ADEs. Either way, vaccine first, then you get sick with COVID, or COVID and then taking the vaccine. What's the deal on that? Is it a real issue, particularly with the boosters coming up? Now they're saying we may need boosters in perpetuity to prevent COVID. Well, could it run the risk of giving us an ADE, an antibody-dependent enhancement that could make us feel really sick? I'm Dr. Ronald Hoffman, 877-726-8255.
Dr. Ohhira's Probiotics, not just another powder in a capsule. With hundreds of probiotic products to choose from, what makes health experts worldwide consider Dr. Ohhira's Probiotics superior? Dr. Ohhira's crowning distinction is the 500-plus postbiotic metabolites produced during its 3-year fermentation process. Why are postbiotics so important? Postbiotics are vital for sustained digestive balance and overall immune health. Postbiotics are fundamental for hormonal balance, weight management, skin care, and brain health. Postbiotics are the Dr. Ohhira advantage that is essential to our health and wellness. Encapsulated in a vegetarian soft gel, Dr. Ohhira's Probiotics is a live paste of 12 strains of probiotic bacteria and nourishing prebiotics from whole fruits and vegetables. Join the millions of people worldwide who know the power of Dr. Ohhira's Probiotics. Go to www.essentialformulas.com today to find a retailer near you or search online.
Staying healthy has never been more important. And Kyolic Aged Garlic Extract, maker of premier heart and immune health products, is leading the way to better health with the groundbreaking new formula, Kyolic Omega AGE. Kyolic Omega AGE combines the cardiovascular power of Kyolic's best-selling, organically grown aged garlic extract with sustainably sourced fish oil and a synergistic blend of the nutrients, vitamins D3, K2, E, and B6, 9, and 12, that have been clinically shown to support heart, bone, and immune health, all in one supplement, providing you with a comprehensive and convenient way to take your health to the next level. So check off all of those individual supplements from your shopping list and get Kyolic Omega AGE for heart, bone, and immune health today. Look for Kyolic Omega AGE at fine natural health retailers near you. Learn more at kyolic.com. That's KYOLIC.com. Stay healthy. Live better.
Welcome back to Intelligent Medicine. Dr. Ronald Hoffman here, 877-726-8255. I want to continue in the vein of that previous call, because it was an interesting call. It was a guy who's had COVID, plus he took monoclonal antibodies, which further boosted his immune system. Now he's concerned that taking the vaccine, he might get a enhanced reaction, like a real kick in the rear, which is referred to as an ADE, an antibody-dependent enhancement. Explained a little bit about it, but I want to continue on this subject, because we do know, for example, that after the first vaccine, a lot of people go, it was like nothing. I felt like, I got punched in the arm, but it wasn't bad. I had no downtime. The second vaccine, which is designed to complete your immunity, when it comes to Pfizer or Moderna, is usually associated with more side effects. And that's because the body is already prepared to recognize the new immune stimulus and rises to the occasion more violently. And you can have fever, and you can have problems. This guy had fever when he got the monoclonal antibodies, which suggests that he has a reactive immune system. And so the answer when it comes to COVID is that they were concerned about that, and they looked for it, but they did not see it to any great extent with the vaccine after COVID, or the vaccine and then you got COVID afterwards, which we did now see. There are a lot of breakthrough infections. But it's something that they're tracking. And the concern arises now that we're talking about boosters, maybe a lifetime of boosters, one every year. What'll happen when the immune system begins to recognize these foreign materials and mounts an increasingly strong reaction each time you get the shot? And that is a theoretical concern, and we're racing to administer boosters to people without really adequate research. I mean, the precedent is that it didn't happen with the first two shots to any great extent, but could it happen with the third, fourth, fifth, sixth, and so on? That's something that which we really need to look for. And in particular, people who've had COVID, maybe they just need one shot, not two, but unfortunately it's a one-size-fits-all approach in the U.S. In other countries, in certain European countries, they're now talking about a one shot after you have natural immunity. They do want you to have some additional protection, but do you really need two shots? And are you running the risk of a really strong reaction with two shots? They are concerned about it. So the answer is we don't know yet, but we need to track it. That's a possibility. All right, 877-726-8255, our number. And let's talk about something you can do for ordinary everyday fatigue or fatigue associated with certain medical conditions. Here's the only nutritional formula that's clinically proven to repair damaged cells, in particular targeting the mitochondria, and it helps to improve your body's natural energy production. It's NT Factor from Nutritional Therapeutics. There are clinical trials, lots of them, that have shown that NT Factor reduces fatigue by almost half. And many patients and consumers report that it really works on their fatigue. NT Factor is available in a variety of formulations, tailored to your specific needs. You can get full spectrum vitamin mineral formulas like Pro Packs, or you can get specific immune support formulas, or you can obtain pure NT Factor in wafer form. Works really well to get high doses that you can add to whatever supplement regimen you're already taking. I've been using NT Factor for years, and I prescribe it for my patients. There's a 45-day money-back guarantee, and you have nothing to lose. So you can find the NT Factor line of nutritional formulas at your favorite health food store or online retailer, or you can order direct by calling 800-982-9158, 800-982-9158, or they've got a new user-friendly website, ntfactor.com. That's ntfactor.com. Try it. All right. This previous call, the guy said, I'm suffering from ringing in my ears ever since I had COVID. And, well, it may be coincidence, but there's a new study that suggests that at least one long-term COVID-19 symptom, we call these long hauler symptoms or long COVID, was found in 37% of patients 3 to 6 months after they were infected by the virus. This study comes to us from Oxford University. And the most common symptoms included breathing problems, fatigue, pain, and anxiety. The symptoms were more frequent among people who had been previously hospitalized with COVID-19. They were more common among women. Older people and men had more breathing difficulties because the lung was affected. They had cognitive problems. That's worrisome because it suggests that COVID may accelerate the progression towards dementia in some vulnerable older individuals, whereas young people and women had more headaches, abdominal symptoms, and anxiety or depression. So, there's tremendous need for research on long COVID because we're going to see more and more people who don't recover completely. Our today's audio engineer, Steve, he recounted his story of getting a breakthrough infection last week on the air. And he says only just now, weeks later, is his sense of taste and smell returning. And for some people, that just persists really a long time. Will these symptoms abate, or will some people be permanently afflicted? It's too early on to really know. But long COVID is a thing, and that is concerning. All right, this item on dairy. For years, experts have urged adults to skip fat-laden dairy foods. It's all that fat, that gunk ends up in your arteries, clogs your arteries, gives you heart attacks and strokes. So they urge you to have this watered-down skim milk or 1% milk. I hate it. Or low-fat cottage cheese, low-fat cheese or cheese substitutes. They're really awful. So in this study, they did something kind of unusual. A lot of studies rely on people recalling, did you have this? Did you eat that? Did you have cheese? Did you have full-fat milk or, whatever? These studies are very unreliable because people's recall is terrible. A lot of people, don't even remember what they had for breakfast yesterday. So they measured levels of certain fatty acids, which are building blocks that are found in dairy foods. And that actually gives you a better fingerprint of what people consume. Because where do those come from? Either they came from dairy or they didn't. So they were able to determine who was consuming a large amount of dairy or not. And what they found was quite interesting. They found that dairy fat from milk, butter, and cheese could actually prevent a heart attack. If anything, there was a slight trend towards reduced risk of cardiovascular disease. So I have here the study in men and women with metabolic syndrome. They picked people who are already at risk, right, so that they could see a more robust result. Because these people, ordinary healthy people, you have to follow them for years to see if they get heart attacks. But in metabolic syndrome, that becomes more likely. So they found that a diet rich in full-fat dairy had no effects on fasting lipid profile or blood pressure compared with diets limited in dairy or rich in low-fat dairy. Now, the nice thing about dairy, and high-fat dairy in particular, is that it provides satiety. Because if you don't eat any fat, what are you going to turn to? You're probably going to turn to carbohydrates. And carbohydrates drive insulin resistance, which is the basis for metabolic syndrome, weight gain, prediabetes, and full-blown diabetes, heart attack, and stroke. So if you're not allergic to dairy, if you have GI intolerance to milk, I get it, okay, then have fermented dairy products, cheese and yogurt, you'll tolerate that. So in this study, they actually determined that dairy in the form of milk, yogurt, and cheese, regardless of fat content, did not affect the fasting serum lipid profile or blood pressure compared with a diet virtually free of dairy in both men and women. Dairy is soon to be exonerated for so long. I mean, I can just go to the supermarket and you see all these dairy alternatives. Why? And many of them have a lower fat content but a higher carbohydrate content than whole milk and cheese products. All right, 877-726-8255 if you want to get in on the action. Promise to share this one with you. Supporting female libido. When it comes to libido and sexual performance, men have it all over women because there are a raft of drugs that are used to treat ED. And they work to some extent. Not perfectly, but at least they help the cause. But for women, they're kind of left high and dry when it comes to medications. They tried some newer medications. They have side effects. Side effects include fainting, which is really not romantic. You know, if you take a medication and then you pass out when the occasion arises, well, that's not going to enhance your sex life. This is about a supplement available over the counter, DHEA, as support for female libido and fertility. It turns out that both men and women have DHEA. DHEA is a weak androgen. It moves a little bit towards testosterone in women and a little bit towards estrogen in men. So I generally suggest that when using DHEA that you get some input from a health practitioner who's familiar with DHEA. But they found that DHEA significantly improved libido in women over 70, and it also positively affected bone health. DHEA may also improve libido in younger females as well. In postmenopausal women aged 50 to 60, DHEA at a low dose of only 10 milligrams per day, very safe, was shown to significantly improve sexual function and frequency. So when it comes to fertility, and I've used this with some of the women who are, going through these horrible cycles of IVF, frustrating cycles, continued failure. Taking DHEA has proven helpful in increasing the likelihood that IVF, in vitro fertilization, will be successful. Now, what's interesting, in some of these studies, a substantial number of the women spontaneously became pregnant the old-fashioned way. They just got pregnant without the IVF. Of the women taking DHEA, in 39 women under age 40 who had previously been poor responders to IVF, there were 10 spontaneous pregnancies, while in women age 40 and older, that's tricky, 21% of those taking DHEA became pregnant. So, wow. That's a supplement available to you, so far not yet banned by our friends at the FDA. But in my opinion, should be taken with the doctor's supervision and input. 877-726-8255, our number for Intelligent Medicine. There's never been a more important time to ensure your immune system is operating at its peak. This is Dr. Ronald Hoffman with a new natural solution from Future Farm Botanicals created exclusively to help promote a better immune response. Elderberry with zinc and echinacea. Future Farm's elderberry with zinc and echinacea is the first to combine these three powerful ingredients together. Elderberry is packed with antioxidants, vitamins, and may boost your immune system. Echinacea has been shown to activate chemicals in the body that decrease inflammation, and zinc activates T lymphocytes. Low zinc has been associated with increased susceptibility. For more information and to order, call 888-841-7216. That's 888-841-7216, or go to myfuturefarm.com/Hoffman. That's future, P-H-A-R-M, myfuturefarm.com/Hoffman. Elderberry with zinc and echinacea is all natural, science-based, and works without adverse side effects. myfuturefarm.com/Hoffman. myfuturefarm.com/Hoffman. Do you suffer from numbness, tingling, burning, or pain in your feet and legs? It could be caused by something as simple and common as a B1 deficiency. This is Dr. Ronald Hoffman with a solution for low B1. Zobria. Zobria is a safe, effective, and clinically proven nutritional supplement containing a high-potency bioactive form of vitamin B1, which has been shown to reverse symptoms caused by low B1 with no side effects. Low B1 causes your nerve cells to stop functioning properly, resulting in numbness, tingling, burning, and pain in the feet and legs. It may also contribute to forgetfulness, loss of mental focus, fatigue, and loss of appetite. Restoring proper B1 levels has been shown to improve the functioning of these nerve cells. You can get Zobria risk-free by going to zobria.com. That's zobria.com, and get 20% off with coupon code Hoffman at checkout. This offer is only available to Intelligent Medicine listeners. That's zobria.com. Vitamin B1 perfected. Welcome back. I'm Dr. Ronald Hoffman. During the lockdown, I said to myself, is it my imagination or are people driving really crazy? I'm driving on the Long Island Expressway and I'm going 65 and people are zooming past me. The speed limit is 55, especially in the throes of the lockdown. And then I listen to the morning traffic report and it's like, jackknife tractor trailer here, fatal crash there. It's like mayhem on the roads. And according to the study, it's not my imagination. Deadly auto crash is more likely during pandemic lockdown. And while the volume of traffic decreased and there were less overall accidents, the severity of the accidents increased. They say while the total number of collisions declined after the lockdown, the proportion of those crashes that were incapacitating or fatal more than doubled. People are driving crazy. They're angry. They're frustrated. And the lockdowns have not had a good effect on motor vehicle fatalities and serious accidents. All right, this week I attended virtually a conference of the American Nutrition Association, the ANA, and there was a great presentation by a guy with an interesting name. His name is Dr. Satchidananda Panda, like a panda bear, P-A-N-D-A. He's a PhD at the Salk Institute for Biological Studies in La Jolla, California, on intermittent fasting. Now, the guy speaks perfect English, he's very Americanized. And he mustered evidence that suggests that the timing of what you eat is as important as what you eat. And they did a lot of studies down in La Jolla looking at the same identical diet, but administered in a haphazard fashion, where people wake up and they have breakfast at 8 and they keep eating, until midnight, virtually, 16 or 18 hours a day, and then they sleep. Sometimes they wake up even when they sleep to have a little snack, go to the refrigerator, versus people who fasted 10 or 12 hours a day, and or more radical form of this, they just left themselves an 8-hour window for eating. That's the 8-16 pattern. And they found that the same amount of calories, when consumed in a limited window of eating time, produced less weight gain and was much better for blood pressure, for cholesterol, for HDL, for inflammation, for many of the factors that we consider contributory to disease risk. And so this is going to be a very, very important paradigm going forward, is intermittent fasting. Not so much what you eat, but confining yourself to eating breakfast a little later and eating dinner a little earlier, and then just not eating. Stop eating. Give your body a rest. Lots of repair occurs, lots of adaptation. You go into mild ketosis when you don't eat, and that is very beneficial for your health. In this final study, when it comes to asthma, is there really a dietary strategy for asthma? Yeah, maybe if you're allergic to something, allergic to dairy or allergic to wheat, okay, that could help. But this study from the American Journal of Clinical Nutrition this month, improved diet quality is associated with decreased inflammatory markers in adults with uncontrolled asthma. Uncontrolled asthma means, man, you're breaking through. All the medications in the world aren't keeping it in check. And so what they found is that in these individuals who followed a clean diet, many of these markers of inflammation, including C-reactive protein, but other more precise markers, were dramatically improved. So asthma, yeah, very much an inflammatory disorder and needs to be treated as such with diets high in fresh fruits, vegetables, fish, rich in omega-3 fatty acids. So diet truly makes a difference. All right. Thanks very much for joining us today. We covered a lot of ground. We appreciate your phone calls. 877-726-8255 is the number you can call during the week and record some questions. We'll take those up next week. Check out our website at drhoffman.com, because lots of free information there, great articles, podcasts that you can download. Follow us on social media, Facebook and Twitter, what's left of them. I'm Dr. Ronald Hoffman, and this is Intelligent Medicine. Have yourselves a great weekend.